Welcome to Discovering True Health, where our goal is to provide you with cutting-edge health information through research, interviews with experts, and personal journeys to true health. Our message is a message of hope and healing, and our mission is to bring you on a journey to discovering true health, to not only find wellness, but to thrive. Hello, everyone, and welcome to Discovering True Health, your weekly deep dive into health and wellness. Thank you so much for joining us today. Don't forget to hit the subscribe button to stay up to date on all our upcoming shows. You can also check out additional information on our website, Instagram, or Facebook. All those links are below. So today we're going to be talking about what therapies and practices help improve the lives of those living with chronic illness and chronic pain. So my guest today is Kelsey Harris. She's a registered clinical counselor. She works with people living with chronic illness and chronic pain and other mental health conditions, and she specializes in using a therapy called ACT, which is acceptance and commitment therapy. She's also a host of a podcast, Chronically Living and How to Make the Most of It. And she is a chronic illness warrior herself. So she's definitely an expert on everything we're going to be discussing today. So welcome, Kelsey. And thank you so much for joining me today.
Thank you so much for having me. I'm really excited to be here.
Awesome. So now, Kelsey, you've personally experienced the negative effects of chronic illness, which is what started you on this journey to becoming an expert on it. So can you share with us your journey and how chronic illness has affected your life and how it led you to helping others with your work?
Yeah, absolutely. So it started about 5 or 6 years ago. I noticed that I was having increased pain in various regions of my body, and I was feeling really tired. And I had just moved to Toronto in Canada from a smaller city. And about 2 months in, my spouse and I got separated. So it was a very stressful time of my life. It was a mutual separation. No hard feelings. It was probably the least stressful separation ever, but it's still, in retrospect, I was like, oh no, that actually probably was pretty stressful for me. And so I noticed all this pain, and I went to my GP, and he ran a bunch of tests, and he said, I think you have gout. Like you have high uric acid levels. He takes these pills, it'll make it go away. You'll be fine. So I take the pills, and it doesn't really help anything. So I decide to go to the ER and just see what the doctor there will tell me. And the doctor there
was it a constant pain? Like it was happening? It was constant?
It was most of the time. And it was kind of widespread at this point. So most of my body.
Wow.
Yeah. So the doctor in the ER was like, I'll run a test for Lyme disease and stuff like that. But I think you might have an autoimmune disease. I'm going to refer you to a rheumatologist. I was like, great. This is actually what I wanted. I wanted this referral. So I go to a rheumatologist. I actually got in fairly quickly. I think it was a month or so, which is extremely fast to get in. And she ran a bunch of tests, and I flagged really high on the anti-nuclear antibodies, or ANAs, and which is a pretty good indicator that you have an autoimmune disease. It's not a perfect test. But based on that and my symptoms, she was like, I think that she's like, first of all, you didn't have gout at all.
Wow.
She's like, you can't have gout if you have your period. So if you're having your period, you're no gout. But she's like, I think you might have lupus. So we'll monitor it and see how it goes. And then 4 or 5 months later, she's like, hey, I'm going to add fibromyalgia to this diagnosis. I think they usually go together. Some of your pain really wouldn't be explained by, your joints being in pain because you've got some muscle pain. Okay. And then about a year later, she's like, I don't think you have lupus. I think you have undifferentiated connective tissue disease, which is a mouthful to say, but also it's kind of like, you have some symptoms of lupus or some symptoms of rheumatoid arthritis, but not enough to actually warrant a diagnosis of either. So that's where we've landed and kind of where I've been since. So that's my story in a nutshell.
And along the way, did they prescribe you medications to try to mitigate it? Like, what was the kind of treatment plan that they came up with?
Yeah.
along the
So
way?
the treatment plan really was a lupus treatment plan. It was hydroxychloroquine, which I still take, and a few other medications. So Lyrica, which pregabalin is the regular name, and non-steroidal anti-inflammatory drug, which I've switched which type since, and I really only take it now as needed. It really did a number on my stomach. So for me, it was like, I need to find some alternative ways of healing.
You don't want to destroy your gut in the process.
Yeah, it's exactly what was happening. And I was like, this is just not fun.
Just did a show on that. It's so important.
Yeah. So, and then I ended up looking for some alternative health models as well. So my rheumatologist was great. Actually, she said, maybe look into a naturopath or physiotherapy. These things often help my other clients. So that's what I went and did. I got a naturopath, I got a physiotherapist, chiropractor, went for massage therapy, and a psychotherapist. So I was like, I have all the things, and it actually really helped my health a lot. And there's a lot of things that I still continue to do because of that.
Wonderful. And then that experience led you into, getting into this, what you're in now.
Yeah. Yeah. So like I mentioned, one of the things I did was see a psychotherapist, because I found I was feeling very anxious about this whole process and having an illness, and now trying to date and have relationships again while having an illness. And I was in pain a lot, and I was just like, I need someone to talk to. And so she was fantastic. I saw her for like 4 years, and along the way, I was like, I kind of want to help other people in the same way. And I looked at different career options, and my background is in film studies and filmmaking and retail. So like, I was like, this is going to be a big departure no matter what I do. And I was like, I think the mental health thing is something that we often overlook when it comes to chronic illness. So that's the part that I felt I could help other people with.
Absolutely. Yeah. It's very big part of it. Now you are a therapist now at this point in your journey, and you specialize in working with people now with chronic pain and chronic illness. What are some of the common client situations that you see in your practice?
Yeah, so the big three would be anxiety. So kind of like what I went in for, whereas people come in, they're very anxious about their diagnosis or just life in general. Often they've maybe had anxiety in the past, and this has now made it worse. It's pretty common. Another one's depression, right? People feel really depressed, which makes sense, especially if you can't do all the things that you used to do, or you've had relationships fall apart because of it. So a lot of depression comes in. And then the third one, which is one we don't really talk about a lot, but is the most common, which is chronic disease distress. So this is when you have anxiety or depression that's really just about your illness or your pain. And looking back, I'm like, actually, it's probably what I had was just chronic disease distress. It was a little bit about the relationships and stuff breaking up around the illness, but it was really about the illness. And up to 50% of people with a chronic illness actually have chronic disease distress. So, and only about, 12 to 15% actually have anxiety or depression. So it's the most common by far.
And the symptoms display for that the same as kind of anxiety and just depression, but they're just related to their chronic illness.
Yeah, exactly.
Yeah, I get that. So now, how is our mental health affected by chronic illness and chronic pain? And can you talk a bit about the mind-body connection? I know there's depression, anxiety, but does it change something in our brain, the way our brain functions? What's going on there?
Yeah. So I think the most important thing to remember is that our brain really perceives and controls everything in our body, right? So for anybody who's a little skeptical about the body-mind connection, you just have to remember that your mind is literally always involved. To what degree kind of can depend. But one thing we see a lot with chronic pain, for example, is that as your pain gets worse, your anxiety gets worse. As your anxiety gets worse, your pain gets worse. And same thing with depression. So you get looped into a cycle where, where it's one is always affecting the other. And so when we treat one or the other, we can hopefully get them both to get better. Or most effectively, I think, is just to treat both at the same time. So your depression and your pain, or your anxiety and your pain. The body and the mind are really always talking to each other. And that's often why we get things like depression when we have a chronic illness, is because the part of your brain is your prefrontal cortex that controls your mood is also where your pain is perceived.
Wow.
Yeah. So in that sense, it kind of makes sense why the two are always interacting in that loop, right?
Your brain doesn't differentiate whether it's the actual physical pain or it's like a mental stressor.
Yeah.
It kind of comes into the body as physical pain too.
Yeah, exactly. And I think because they're like basically like next door neighbors, they just, it doesn't take much for them to talk to each other, really.
Wow, that's fascinating.
Mm-hmm.
So the higher anxiety gets, the more pain you'll feel, the more depressed you start getting, that triggers more pain. And it's just this vicious cycle.
Yeah, exactly.
Wow. Now you work with several different types of modalities and treatments. Let's start with the psychological therapy. How can psychological therapy help those with chronic pain?
Yeah, so there's actually a lot of really interesting research that shows that psychological therapies that are targeted at chronic pain can actually help with your symptoms of chronic pain, which is really, really fascinating. There's a huge amount of research on this. For my master's degree, I actually wrote a paper. My final paper was basically about this exact thing. So I got really well versed in the research, but basically what it does is, because we're targeting, that area of your brain, your thoughts, your feelings. And when our thoughts or our feelings are really about our pain a lot, it kind of makes sense that, again, you're targeting that part of yourself to make you feel better.
Kind of like whatever you focus on will grow concept.
Yeah, exactly. Yeah. Yeah. So, basically psychological therapy is just they were looking at anxiety and depression to treat as well. But we can also treat the illness side of things to a certain degree.
Got it. Yeah, it's fascinating. Now, you also specialize in a treatment called acceptance and commitment therapy, or ACT for short, which I'm really excited to learn about. And it's based on 6 processes that are central to health and well-being. Can you talk about what ACT is and what the 6 processes are?
Yeah. So we actually call it ACT. So, because it's an active form of therapy. Yeah. So I know it's confusing because when we say things like CBT for cognitive behavioral therapy, we're used to spelling it out, but it's actually ACT, which is really fun. Okay. So I was introduced to this modality during my practicum. One of my supervisors and I had been talking about my interests and the populations I wanted to work with, and just how I view psychology in general. And she's like, "Oh, I think you'll really like this. Take this like online 8-hour course." So I took the course and I was like, "Well, this makes so much sense." And one of the first things they said is, this is a large evidence base for working with people with chronic pain and chronic illness. So I was like, okay, perfect. So basically what acceptance and commitment therapy is a type of cognitive behavioral therapy. So we are working with our thoughts and feelings and behaviors, but it's also very existential. So a lot of like life meaning comes in, which when you have an illness was really important. Mm-hmm. And then it's very experiential. So we, sit and talk in session, but we also do something at the end of every session. So I always take the last 15 to 20 minutes to do, maybe that's a guided meditation, or maybe it's, we're getting up and doing something more physical, but we're always doing some kind of experience in session. And that's going to make sense when I explain these 6 processes. Got it. So first process, and I'm going to give them an order, but they actually can be done in any order. There's no order to them. Got it. But the first one is contacting the present moment. So most of us are going to think of this as mindfulness. I would say the only caveat to that is that mindfulness is part of 4 of the processes. So Yes, it is definitely. This is where we're going to do probably more meditations and really make sure that we're feeling present.
Got it. So it's kind of like get out of the past, get out of the future, be here.
Exactly. What's your current experiencing?
Okay.
The second process is self as context. So this is another very mindfulness heavy process. So this one is really about what we're noticing, what we're noticing about that present experience that we're having. What are we able to take perspective and maybe think of ourselves in the future or think of ourselves in the past, looking at this exact moment. And what these two processes can really work together to help us be very present. And then when we're really present, we're not focusing so much on not just the past or future, but like, oh, only my arm hurts today, right? It's okay, but like, what's the rest of my experience like right now?
Right. So you're not laser focused in on your pain. You're more learning how to, take in everything that's going on in the moment.
Exactly. The third process is called diffusion, which is a bit of a silly name. But what it is, or how I explain it to clients as well, is just you're creating distance between yourself and your thoughts. So usually when we're depressed, anxious, or just in a lot of pain, our thoughts are like right in front of our face, right? Like they're right here. It's all we can focus on. And when we create some distance between ourselves and them, we can then see and feel and experience everything else that's going on. So this is a really important one that we need to do. I like to do quite usually a lot of this with clients, because those thoughts, they keep creeping up. And the biggest difference between this and the way regular CBT treats thoughts. So in regular CBT, we're talking about maybe changing the thought. We look at the evidence. So is this thought real? Is it not real? Okay, let's change it to a different thought. In ACT, we don't do that, actually. We just see thoughts as passing. So our brains are designed, this is their evolution of our brains, is to generate thoughts. And these thoughts are trying to help us and protect us. And just sometimes they don't do a good job of that. So we just need to recognize that the thought's going to come and it's going to go, and it's going to get replaced by another thought that's going to come and go. And as we learn to do that more, again, this is where that mindfulness piece comes in. We can see that our thoughts are not the only thing that's there, and we can focus on everything else.
Yeah, that's so powerful. I mean, I've been a student of self-mastery for many, many years, and that was a big shift for me, is, learning that the mind is a tool, not the master. And
Exactly.
really like learning how to, that's a huge, huge shift when you can really start to hear the chatter, like, and then you're like, whoa, like there's so much noise going on up there. And then learning how to kind of separate from it and then quiet it down and be able to work with it as a tool. Oh,
yeah, totally. And then the fourth process is acceptance. And so sometimes people get hung up on the word acceptance because it sounds like, but I don't want to accept that I'm in pain.
Right.
And it is about accepting all your experiences. So your pain, your emotions, like sadness, anxiety, frustration, anger, joy, like these are all, we're supposed to have all these emotions, and we're supposed to have pain. Pain is actually supposed to tell us, that, there's danger or that there's something wrong. We need to get something looked after. Same thing with our emotions. What is your sadness trying to tell you? What is your anxiety trying to tell you? These aren't terrible things. We're just conditioned as children to think that they're terrible.
Yes.
So really, the acceptance piece is about accepting that this is okay. We're allowed to have that experience. We don't want the experience to overtake us. So we don't want to, if we're sad, we don't want to just, spend the entire day on the couch crying. But we want to just see, okay, like this is my experience in the moment, and that's okay. So I'm going to give you a real life example that I used today. So I went to a doctor's appointment because I just moved to Vancouver, where I'm living now. And I was like, okay, I need to get a referral to a rheumatologist here. And the doctor would not give me a referral without providing paperwork from Toronto. So I left and I was really frustrated. And
those are the Americans out there that are watching that don't understand the Canadian healthcare system. Because I lived there for 4 years. It's not easy.
Yeah. And and I knew going in, it wouldn't be easy. But I thought, oh, I'll just have to wait a couple months to get into an appointment. I wasn't like, oh, I have to go now, call the other hospital and get them to send it. Right.
Americans, listen up. We do not want this system. You will wait for months to get specialized surgeries or treatments.
I mean, but at least it's free. That's the only thing I'll say.
True, it's free.
But yeah, so I was really frustrated when I left and angry. And I actually felt like I wanted to cry. Like I was like, oh my gosh. And this was like 2 hours ago. So this was like pretty recent.
Wow.
And as I was walking home, I just paid attention to what I was feeling. I was like, okay, well, frustration, anger, sadness, these are like totally valid feelings for me to have right now. Probably 99% of people will be having the same feelings walking out of that appointment. And so rather than, I didn't cry, and not that there's anything wrong with crying, but, I was like, okay, this is my experience. This is valid. I'm going to kind of make some space for that to be there, and walked home and, came on here and, we're doing this now. So, and it's okay to have the experience is
Right.
basically what it comes down to.
You're allowing it, and like, look, this happened. It's okay to feel these emotions. I'm not going to get stuck in them for days, but like you're letting them kind of go through you and then pass.
Exactly. Because just like our thoughts, they come and go. And
Right.
the same thing with pain, right? When we're talking about like chronic pain, yes, there are parts of my body that are in pain, but are they really in pain 100% of the time, or like really intense pain 100% of the time? We think that they are, but if we actually pay attention to them, we'll notice shifts and changes, and the experience isn't the exact same.
Yeah. Fascinating.
Yeah. And then, okay, so process number 5, this one is values. And this really just comes down to connecting with who and what is important to you. And a lot of people, when you ask them, like, what are your values, they're just draw a blank. Like, oh, I have no idea. Which is fair, because it's something most of us don't think of a lot.
Yeah, and it's not something like this should be like in elementary school taught from, like, I mean, it's a vital part of life. And yeah, it's not part of our culture to kind of sit down and think deeply about that.
Exactly. And so values and meaning, and this is where kind of the existential part comes in, are really connected, right? So, we tend to derive meaning from our life from our values. So, when I work with clients, I might pull out a values checklist, or we might just talk about, like, if you were to name like 5 things that were important to you, what would they be? So, for me, for example, I mean, something like my health is important to me, right? It's making sure that I am doing what I can do to make my health the best it is. That's important to me. My family is important to me, but, more specifically, well, getting to spend time with my family is really important to me. And so when you start to look at it that way, you can kind of start to build the life that you want in your head. And this really ties into the last process, which is committed action. And committed action is living a values-based life. So, we'll go back to my earlier today example. So if I had just let those thoughts and feelings overtake me, then I would have probably emailed you and said, I can't do this interview today, and I'm going to lay on the couch and cry. And this is what happens to a lot of people. And it is a totally valid experience. But it's not in line with my values, because one of my values is helping other people. Right. And if I didn't come on,
that value is more powerful than your emotion.
Yeah. And it's just, I was like, you know what? I could be like, well, it's important to me, but I just can't do it today. And like, maybe that's okay sometimes, but a lot of the time, my life today is going to be way better by coming to talk to you. And I knew that. So I was like, no, I'm going to continue to live this values-based life. Something else that happens often is like, I wake up and I feel like I'm in pain, and I'm like, oh, I don't want to do my exercise routine today, but I know that my exercise routine will make my health better, my overall health better. So then I do my exercise routine. And it's really shifting the way that you're looking at life. That a lot of times when people feel depressed, right, they don't want to get out of bed. Very common. And it makes sense. Like you just don't have the energy to. But when people get out of bed and do something that they enjoy, that is based on those values, it's going to bring them some meaning. they start to feel better. And so that's basically the 6-act processes in a nutshell. And you can kind of see how they all tie together as well.
Yeah. And I guess you just said they start to feel better, like going back to you talking about how the emotions are close to the pain receptors in the brain. So now you're kind of flaring up that part of the brain with positive emotions. It's therefore probably physiologically helping reduce the pain.
It
or
does,
overriding
yes.
it somehow.
It does. What we see is like a lot of people have huge reductions in pain, just through doing all of this together.
So step 5 is kind of like creating a life, like a future life vision of like like who you want to be, or like,
yeah, that's
like, this is what I would want my life to look like. And then step 6, you kind of drill down and create your values that will, lead you to that life, basically.
Yeah, exactly. So if I was working with a client in session, we would maybe write down a list of the things that were important to them, what their values are, and sometimes it is like looking back, okay, well, like, let's pretend this is, 50 years from now, it's your funeral. What would you want people to be saying about you? Like, that's a good way to generate some values.
Absolutely.
And then step 6, we would then create like a plan. Like, okay, so like, if you were doing if you were living by these values, what are the things that you would be doing? Oh, I'd be hanging out with my friends. I would be, going to family dinners. I would be exercising, every day. Okay, so then that's the things that we want to get the client to start doing.
Got it. So you're living with your values motivating you instead of living from being just stuck in your mind and your emotions and kind of a servant to those and your pain, basically.
Mm-hmm.
Now you've kind of shifted from that to having these values and this future that you want to attain that are now, that's what you live by.
Yeah, exactly.
Amazing. So powerful. And from your experience, what kind of results have you seen with your clients using this modality?
Yeah, so amazing results, which is why I guess stuck with it. But definitely decreases in depression, where people then you start to go out and do more activities that they enjoy. And they're like, wow, yeah, I actually, don't feel like I want to lay in bed as often as I did before. Anxiety as well. I've had, clients who didn't want to go to the doctors or the hospital or whatever. And then they're like, okay, wait, no, actually, like, I can get there and I can get through the door. I can sit down. I can wait till the appointment starts, and actually just feel more calm and able to do it. And it's not that they don't not that these people are not experiencing depression or anxiety. They still have some of that sadness in them. They still have some of the anxiety, but they're just able to not let it overtake them. They're able to continue to do the things that they need to and want to do anyway. And then with pain, I've seen clients have huge reductions in pain, or, pain less often. So rather than be like, it was literally all day, every day, to being like, oh no, like, actually there was like a good couple hours where I didn't have really any pain, and I was able to then go do some fun things.
That's incredible. And it makes so much sense. Now, you also mentioned earlier, you talked about meditation. So you also use meditation as well to help those with chronic illness and chronic pain. So how is meditation helping? What are the positive effects of it that you're seeing, and the health benefits that you're seeing with your patients?
Yeah. So I really got into meditation because my therapist and my naturopath were both like, meditation, do it. Like, so we do it in sessions. And I started to notice that for me, it was making a big difference, because I felt more centered and grounded and present than I had before. I wasn't, ruminating about the past. I wasn't anxious about the future. I was really starting to just be here now. And the same thing with clients. When I've done recaps with clients at the end of therapy, when, okay, you tell me what's been helpful for you. What did you take away from this? A lot of time they say things like the meditations or mindfulness, or, just being more present. I feel like I'm more present in my life now. And I think that's really just says it all, right? Like, it literally can change parts of your brain, because our brains are again they're actually designed to think about the future and the past. They're not designed to be here in the present with us. So you're actually making changes in your brain by practicing meditation regularly, if that's what you do.
That makes a lot of sense. And is there a particular type of meditation that you utilize? I know there's guided meditations, there's all different types.
Yeah. So guided meditations, I think, are great. Like, it's a great place to start if someone, especially if you're not used to meditating. Like I said, I use meditations in sessions with clients, and I just guide it for them. To the point where I had clients being like, I don't know if I can do this without you. So I made a meditation channel on YouTube for them. I was like, just take this, use this.
Right.
But yeah, so guided meditations. So I try to give them a little bit of an act twist to them. But as you know, for me meditating, I downloaded the app Calm. And that's what I use. I got a 10-20 minute meditation, usually guided. I can do unguided, but you know, it's definitely more of I don't want to say a struggle, but it's a little more effort to do an unguided one. But either way, I think it's a great way to really get present.
Oh, absolutely. It's so powerful. And I was just reading a woman's book yesterday, who's going to be my guest next week. And she was talking about, and this really clicked for me, she was talking about how breathing, basically your thoughts affect your breathing and your breathing rhythms. So if you're thinking negative thoughts, change your breathing rhythms, and then your breathing rhythms also affect all these other things internally, like your hormones, et cetera, et cetera. So I was like, oh, because I always felt like meditation is important, but I never kind of heard it in that manner where it's connected, you know, your breath is important, but oh, it actually makes physiologically a huge difference, like really being in control of the breath and being
totally
conscious of the breath.
It activates your parasympathetic nervous system so that you do feel more calm, because that's what you need to calm down from anxiety. So definitely there's a huge physiological effect.
Yeah, so powerful. Now, for those listening, what are a couple of things you can recommend to help, you know, maybe somebody's listening that has a chronic illness or chronic pain that they could implement in their lives?
Yeah, so I think that the easiest thing to do is start with something like meditation, because it's free. You know, like, you can download an app for free, and just start 5 minutes a day. You don't have to do a huge amount. I did 5 minutes, like 3-4 times a week for a year before I even, you know, graduated myself to doing a little bit more. But I would say definitely kind of start there. Another thing you can do is the self-help section in most bookstores is a great place to find books. So if this ACT thing sounds good to you, and you know, are not ready to see a therapist, because some people just aren't ready yet, and that's totally fine. There's a great book by Dr. Russ Harris. He's an Australian psychologist, and his book's called The Happiness Trap. Okay. And it uses those 6 processes in like a self-help way. So I would say check that out.
Okay, I can post that. I can link that below. I'll look for it. Now on your website, you talk about something called a spoonie, which I've never heard that term before. Can you explain to us what that is?
Yeah, so that term, I can't remember the woman's name who came up with that term, but this was, I want to say, like 20-25 years ago. And she basically used this analogy to explain what it's like to have an autoimmune disease. So you have, basically, it's like you have a bunch of spoons, and you might start your day with 5 spoons. And then every time you do an activity, you take away a spoon, like you have less energy. So when you're down to 1 spoon, you're not able to do much. And if you run out of spoons, you're sleeping, basically. It's a way that it's a term and a way that a lot of people use to describe their chronic illness, particularly autoimmune diseases. It's not, I use the term, but it's not my favorite term, because I like to think of myself as a warrior. Like, yeah. And I mean, some people don't like the warrior term. They don't want to think of themselves as fighting a battle. And, you know, I totally appreciate that. And they would rather think of themselves as a spoonie. But for me, think being a warrior feels like I have more power and more control over my illness than saying I have to take away these spoons. However, I totally agree that the spoonie analogy is very accurate.
Yeah, it makes sense. I mean, I've been a COVID long hauler for over 18 months. So that makes a lot of sense. I mean, that's how it feels. You're like, and if you're new to being to chronic illness, it's a bit shocking at first.
Wow.
But yes, we are warriors, not spoonies.
Totally.
So we can find you on chronicallyliving.com. And I'm going to post a link to that below. And you are located, as mentioned before, in beautiful British Columbia, Canada, which was one of my favorite places to live in my life. Now, if anybody out there wants to book a session with you, do you do virtual sessions or do they need to be in your area? How do your appointments work?
Yeah, so I do virtual and in person. So virtual, you do have to be in British Columbia, but you don't have to be in Vancouver. So just somewhere in the province. And then in person, obviously you would want to live closer. So I work out of two practices. So one in Port Coquitlam and one in Coquitlam. So if you're in the Tri-Cities area, you will know what that is if you live there. Then definitely you can see me in person, or if you don't mind driving a little further. I work out of Advanced Health and Wellness, which is in Port Coquitlam, and then Westwood Total Health in Coquitlam.
Got it. Okay. And you also have a podcast and have written a few ebooks. Can you tell us about the podcast and any other resources you have for those that are dealing with chronic illness and chronic pain?
Yeah, so the podcast is Chronically Living and How to Make the Most of It. So it's kind of like this, where I bring people on to talk about their experiences with their illnesses and what they do to improve their lives. Some healthcare experts to give us some suggestions of, whether it's exercise or diet or, whatever else to improve our lives. And then I usually do some solo mental health based episodes to kind of, again, give some more ideas for that particular aspect of it. And it's a weekly podcast. It's available everywhere you get them. So definitely come check that out. And then, I have a couple ebooks available right now. They're exclusive to Patreon. So if you want to become a patron of Chronically Living, then you definitely get those, as well as other things for your monthly donation. And then, I'm also working on a self-help book, which I'm just in the process of doing a bit of an edit on. And then I'm hoping that I can get it published sometime in 2022.
Oh, I love that. Excited for you. So we can become a Patreon of your website, where you get access to all the ebooks and a lot of other information.
Yeah, bonus content. So the podcast episode, you get extra content from that every week as well.
Got it. Great. All right. Well, thank you so much for sharing your journey with us today and your knowledge. And thank you so much too for your continued work helping all the chronic illness warriors out there. Before we wrap it up, do you have any final thoughts or words for those living with a long-term illness or chronic pain?
Yeah, I know that it can feel really hopeless at times, especially if you're early on in your journey, but it really doesn't have to be. There's other things that you can do to improve your life and to still live a great life. And there's lots of people out there doing that, and really just looking to them and looking for what they're doing is a great place to start.
Beautiful. I love it. There is hope and a silver lining. If you like this video, please like and share with others. This information could really help someone you may know. And don't forget to hit the subscribe button to be sure you don't miss out on our future shows. And remember, knowledge is power. The more you understand about your body, the better you're able to stay healthy and prevent disease. And just a reminder, I'm not your doctor. Don't take this as medical advice. If you have questions about your healthcare, reach out to your practitioner, and stay tuned for the next episode of Discovering True Health.